Hello, welcome to episode 2. If you are new, please subscribe. I'm doing some interesting stuff this week, like dissection and boot camp. Let's get into it. So starting CST with 2 days of boot camp and getting the opportunity to practice some core skills. Here's an animal bowel anastomosis where I'm going to practice my suturing. My suturing isn't great, so it's a great opportunity. Day 2 is cadaveric dissection. I'll talk to you about that a little bit more later, but obviously I'm not filming that for obvious reasons, respecting dignity and all those kind of things. On this day 1, I am getting to practice things like vac dressings with bridging, which is what you're seeing here. And I even get a lap skills box to take home with me so I can practice my laparoscopy skills. So I'll show you that more in another video, but here it is. Here's all the goodies. Good morning. So today is cadaveric course day. I'm really excited about this. Number 1, because it's at my close local hospital. 2, because it's an early finish. 3, because there's coffee and lunch provided. And 4, because I'm genuinely really excited to go and learn. I think it's going to be really helpful for my MRCS. So I'm going to get changed. I didn't have a chance to do my laparoscopic box last night, so I'm hoping that Ash is going to build it for me today and we can have a look and play with it this evening. Back in the med school, and I'm here for my anatomy course. I'm going to try and find the suite. It says E1 meeting room. This way. We go this way, and I'm very excited for the day. I'm wearing my figs. So I had an amazing day. We did some cadaveric dissection. I'm so grateful to people that give their bodies in this way. So we got to practice a laparoscopic appendicectomy, we did an open hernia, and we did a cholecystectomy. So we got to practice lots of laparoscopic skills, suturing, closing, all that stuff. So a really great day. And I took this vegan platter, which was ordered especially for me. So I'm happy. So I'm off boot camp now. I'm back on just a normal clinical shift. I'm really keen to get into theatre and practice those skills that I've been doing the last 2 days. That's always been the problem that I've had, is that I've done the courses and then I haven't had the ability to get into theatre and use them. So I'm actually looking forward to work. That said, I am at the moment always looking forward to work. I worked really hard to get onto CST. The application was insane and no regrets at all so far. I'm really, really happy to be doing what I'm doing and just kind of keen to start the day, and hopefully it all goes well and I get into theatre. I'm excited, so let's see how the day goes. Had to come and just take 5 minutes. Seen a young patient with a very unfavourable prognosis, and just needed a minute. So I'm just on my lunch break. I just had to consent a patient for a flexi sig. It's proper CST fodder, learning how to do consents, things like that, especially for simple procedures like a flexi sig. I asked the registrar to come with me because I wanted to get some feedback on how I did, just to make sure, if the patient had any questions that I couldn't answer, that we delivered the best patient care, so I asked her to be there. At the end, asked for feedback, and she was like, oh, the patient looked really scared by the end of it because you kept doing this every time you said flexi sig. So I am absolutely mortified, and I'm definitely going to be improving that going forward. Otherwise, day's going well. I've just had my lunch, so I'm just about to go to theatre. So I hope that goes well. So I wanted to reflect a little bit after my shift yesterday. So I did get a little bit upset and overwhelmed about a patient who was a little bit poorly, and I wanted to talk about it because it's something that we all deal with as doctors. But more than that, it's a key part of human existence, and it's something that pre-meds always ask me about. How do you deal with the emotional side of being a doctor? And I'm always like, well, it's fine, because the reality is that the bread and butter of being a doctor is not highly charged or emotional, because the majority of patients in hospitals will go home, they'll get better, or they're dealing with chronic issues which aren't going to get better, but they're going to have, a good quality of life. And even where you meet patients that have, terminal prognoses, often you're not there right in that moment where, it's all really emotional and highly charged. You'll often meet them you know, when they're coming with their family for some bloods and they're happy and they're talking about going on a picnic, or so it can be sad, but it's not always sort of gut-wrenching. My kind of worst specialities for dealing with this were haematology, where I saw a lot of very poorly young people, and child psychiatry was pretty gut-wrenching for different reasons. But I did see a patient yesterday who kind of got me in the heart, and it wasn't a breaking bad news moment, actually. It was just her situation I found quite stark and quite upsetting. And the way that I dealt with it was I screened my emotions at the bedside. I was on consultant ward round anyway, so it wasn't like I was doing anything other than scribing, but I took myself off quietly to the toilet and I had a moment and just sat and reflected, and then I went back when I was clear in the mind. But yeah, it's something that I wanted to kind of add into this diary, this reflection, because this is part of being a doctor. So yes, and the rest of the shift was good. I managed to get into theatre and observed a case. So in terms of core surgical training, in order to pass my ARCP, which is like my end of year kind of assessment, I have to have logged so many cases, like 150, but they can be observations. So at this point, I'd rather not be observing. Like obviously I've been at boot camp all week, so I kind of really wanted to get into theatre and practice those skills that I've been doing the previous few days. So I'm a bit disappointed that didn't happen, because I'm off. So if this is the first video that you're watching, I'm at 70%, so I'm not full time. So now I'm not going to get back into theatre until Monday, so that's a few days away from now. So I was really keen just to kind of get in and practice those skills that I've been, I don't want to lose it. That's my issue, is that I've, been and done basic surgical skills, and I've been and done a refresher at basic surgical skills, but then I'm not having the opportunity to practice it in theatre, and so I'm not building it up. So I learned a lot by observing. I observed a hemicolectomy, which was great, and everyone was very keen to teach, but I feel like at this point I really need to get in and do some suturing and all of that stuff. It's difficult when you've got multiple core trainees and registrars and things like that, because it can make it difficult to get into theatre. But yeah, good day, and today I'm off, because 70%. And tonight I am going out for dinner, and that will finish this vlog. And then I will be back. I'm not sure whether I'm going to vlog next week or the week after. I'm doing some night shifts soon, which I will definitely be vlogging. So thank you very much for watching so far. I'm just going to finish off with what I'm doing this evening, and I hope you enjoy that. I do have some teeny tiny residual feelings of guilt when I'm off. Because obviously I'm 70% and everyone else is at work and I can hear them all chatting. But I probably shouldn't do, should I? Because, oh, I don't know. Sometimes I feel guilty about it. It's my mum's cat here, feeling very neglected. Picture that. This is the graduation wall. Do not love this photo of me. So that's me off out for a lovely dinner with my friend. That's the end of this vlog. Please like and subscribe, and I will have a new vlog for you soon. Have a lovely week.